Oh, hi. Sorry, Rob, are you all right to see the new referral? I've got the other clinical fellowship examiners about to join me on a conference call.
Sure.
Call me if there's any worry.
You got a minute?
Yeah.
Boss, just out of interest, who are the other examiners?
Two externals, Hilary Sachs and Manyam Virendra, plus William Lucas Hall, the postgraduate dean. I'll be examining as well, but I won't interview you, since as your consultant there might be questions of partiality.
Partiality which way?
Maya not on the ward, then?
No, Roger's given her leave.
Oh, how convenient. When he's abused his position of power and ruined the poor girl's life and career. Hmm? Oh, my God, Donna, this is priceless. Hmm? This is a bloke. And when you phone him up, he goes, yes, please leave a message after the high moral tone.
No one can be 100% sure of all the facts, apart from the two people involved.
Donna, so we get Maya to make a formal complaint, or we make a complaint on her behalf. Either way, it's better coming from you, better coming from a woman.
Thank you. Miss Gray? Mr. Lake? Miss Gray, I'm William Lucas Hall, postgraduate dean. I'll be one of the external examiners today. Please look at the slide for a few moments, then tell me when you're ready to receive questions.
Now, Mr. Lake, tell me about this specimen.
It's an ovary displaying a gross appearance of endometriosis, multiple chocolate cysts.
Nice, easy one to warm you up.
Thank you.
Thank you.
Please describe the histological appearance of the specimen.
The slide shows proliferated chorionic villi in a state of degeneration.
Which conditions would you associate with this appearance?
Hydatidiform mole and choriocarcinoma.
Good. Very good.
Now, where else might you find endometriotic foci?
In the retrovaginal pouch, the uterosacral ligaments, surface of the pelvic peritoneum. More rarely, the umbilicus, abdominal scars, and very rarely distant organs, such as the lungs.
Can you tell me the genetic character of trophoblast tissue?
I'm sorry?
I mean its karyotype.
I'm sorry.
Thank you, Miss Gray. If you'd now proceed to Mr. Hardy.
How are you, Polly?
Very well, thank you, Mr. Hurley.
William Lucas Hall, I'm very pleased to meet you.
Well, Blake, nice to meet you.
Thank you. Please look at the slide for a few moments, then tell me when you're ready to receive questions. Define the genetic character of trophoblast tissue.
Trophoblast is usually genetically paternal, but with a 46XX karyotype. Rarely, triploidy is seen, a partial mole containing a fetus.
Excellent. Outstanding.
Well done. Very good. Thank you both. Mr. Flaherty, Mrs. Almar, please. I'm Roger Hurley, the clinical director here.
There you go.
Fine, I think.
Well, we must do it again sometime.
We'll see.
Yeah, sorry about the, you know. Morning, Rog. Thought I'd trade her up for something a bit niftier, you know, something with a bit more poke. Yes, Polly calls it my penis extension. Something you don't appear to have any problems with. Oh, by the way, Roger, I'm due to speak with your wife, Harriet, today. GP, isn't she? Referred a patient that I need her to follow up on. So when would be a convenient time to get her attention?
Morning.
Morning.
So you've got the good news?
Yes, thank you, Mr. Hurley.
Congratulations, well done.
Thank you.
So we should meet and discuss your programme for the coming year.
I'm looking forward to that.
Well done.
Thank you.
Rob? If it's any consolation, Rob, it was an extremely close decision. Hi, it's me. How are you? I'm fine, fine. How are the boys? Sorry, I just wanted to see you're okay. Listen, Tony Whitman didn't call you today, did he? Tony Whitman, I thought you needed to speak to you about a patient. Well, we must have got our wires crossed. Yeah, there's something at work I need to talk to you about. No, it's nonsense, but we'll talk tonight when I've got more time. Okay, bye.
Hey,
Harriet.
you can't sound so stressed on the phone and expect me not to worry. Are you okay?
There's a shitty rumour that I've had a thing with my SHO. It's not true.
Why are people saying you have then?
Please, let's go home. Let's talk about it.
Why?
We went on that firm trip out for the Royal College Symposium, and I was seen coming out of her room.
What time?
What?
What time did you go to her room?
Midnight, maybe 1.
You were in there with her. You said you were seen coming out, so you were in there with her in the middle of the night.
Yes.
You go to her room and people think that you went there for sex. There must have been something. You must have been tempted. You must have gone to this girl's room with the idea at least crossing your mind.
Harriet, nothing happened. Harriet.
Something has happened, Roger. You were tempted. All that we've got together our life, our children, the child I'm carrying. You were tempted, at least for 1 second, to risk all that. And what will I think when you call to say you're working late? What will I think every time you go away to give a lecture?
Please. I promise you. I promise you nothing will ever come between me being a loving husband and a loving father. Nothing will ever stop that.
You'll see the boys in the morning as normal. I don't want them sensing a change. And then you'll say you're working away from home for a while.
No, Harriet, please. No.
And the girl.
The girl.
The girl, Roger. She has to go.
Don't go, Harriet. Please, please.
If she spikes under the temperature, I can take another set of blood cultures.
Okay.
Tonight's my on-call night. I thought I should come in, else someone else would have to do extra hours.
Thank you, Maya. Donna, sorry. Do you have a minute? Perhaps working relations between us haven't been quite what they were since I took on the added pressure of the clinical directorship and the HRPU. As the person on staff who's known me the longest, I wonder if I could rely on you to help dispel the gossip about my private life. Harriet's just undergone IVF and I'm not sure what sort of condition she'd be in. I don't even know if anyone believes me anymore. Fucking nerve.
What?
Why won't you believe me?
Roger.
Give me the phone.
Sorry, Mr. Hurley.
Give it to me.
Mr. Hurley!
Give me the phone!
Mr. Hurley!
Give me the phone!
Really hurting
Give me the phone!
Mr. Hurley! In, please! It was a charity thing. I did it for the church fete last year.
I'm sorry.
How unseemly.
I don't understand what happened.
Me neither.
What happened was, Roger Hurley has a girlie.
We're all human. Things can get too much for any one of us.
I came as soon as I could. Roger, please understand right away that I do not regard this as a disciplinary matter. I regard this as a cry for help.
I think we should look again at the burden that's been put on you by becoming clinical director.
No, I'm going to fight these rumours. I'm going to beat them. And demoting me puts out the signal that I'm guilty.
Roger, let's not even talk about that now. First of all, we need to tackle these laughable allegations.
You believe me?
Without reservation. But let's go and find somewhere a little more private to discuss this.
You seen Tony?
Hey, congratulations on getting the clinical fellowship. Thank you. Next, they'll be making you consultant.
Be a while, yes, I hope. Sorry.
A soup of the day and a filter coffee, ladies, please. And, whatever he's having. Bring them over, would you? You know, I think Roger rather cocked up not swinging you the clinical fellowship.
How's that, Tony?
It's not what you know about O&G. It's what you know about the O&G department.
But I'm not a whistleblower, Tony.
I've got Chrissy eating out of my hand, though obviously I'm fear for my hand. It's a formality that my clinical directorship will be made permanent. So, I will get rid of Roger for good. I will reverse his decisions. And then yours will be a smooth path to consultancy.
You're offering me the clinical fellowship?
Well, I'm presuming that retrospective decisions are within my gift. A dictator should control the past as well as the future.
And what about Polly? Hasn't it been given to her?
Well, she's got herself a nice research project that will ensure her international recognition. Thank you.
Thank you. In return for what?
The best time to kick a man is when he's down. You could testify to the Maya-Hurley liaison.
Tony, Roger's got 2 kids. I'm not going to tell a pack of lies that's going to turn him into some dickhead dangling off Buckingham Palace in a Superman suit. If you want to challenge Roger...
If?
It'll have to be for something that he's guilty of. Medical negligence. Nothing else.
Sorry, is this a bad moment?
No, I was just leaving.
Good news. I've just had a very productive meeting with Paul about you staying on permanently as clinical director. I've got a list of some departmental issues we need to go over.
Well, if you contact my secretary, I'm sure we can arrange something for next week.
I've done a search on the effects of cafelocentesis on the baby. Some studies report that draining the CSF leads to temporary fetal bradycardia. Others report no effects.
That's very interesting, Roger.
Rog, sharing your wisdom. Poor girl. You must be working her flat out.
Let's step into the office for a second, shall we, Maya? Sit down. This is an extremely awkward and difficult professional situation.
I see it the same way, Roger. And we have to deal with it professionally.
Maya. You're right.
I'll be day for it. I'm getting impatient.
For what?
Regime change.
He's been...
Let her pull through.
Oh, shit, come on.
Hello there. How are you feeling?
Good. Dr. Dutter. Maybe you didn't think there was anyone you could turn to about this.
About what?
Mr. Hurley. He's acted inappropriately with you. It damages working relationships, Maya, and you've got a duty to report it to your line manager. My door is always open. Okay?
Roger. I've been on your firm a fair while now, and it's probably the point in my training where I'd consider a change of experience. It's for the best, Roger, and it's what I want.
They're the problem, you know, not you.
The situation between us is threatening to undo the good you've done in this department. And that's the last thing I want.
Thank you. Hi, it's me, Harry. I've told her. I've told her she has to go.
Only me.
Mr. Tennant wants to see you both now.
Chrissy, Tony.
Coffee?
I'm fine, thanks.
Thank you.
So, you're arguing about closing down the high-risk pregnancy unit? Yes? Well, clearly that'd be a lot easier if you were planning to do it with my input.
We are, of course, Mr. Tennant. It's absolutely open for discussion. I didn't want to appear hasty as I remain clinical director only in an acting capacity.
Please. Why do you propose we should shut it?
Thank you, Mr. Tennant. I believe that by containing high-risk pregnancies in one unit, rather than reducing risks, as Roger envisaged, you will be increasing them because of the additional strain on an already overworked staff.
The HRPU was won at considerable cost. It's essential for our bid for foundation status. And I have personally staked my position on it. The HRPU will remain. That's all. Thank you, Mr. Whitman. Chrissy, either you're on my side or you're out. Decide.
Under Roger, all the budgets were pissed away on blue sky projects. So, I think it's a time for back to basics. More staff, less spin, more patience, less research.
Can I ask everybody to wait outside? Not you, Mr. Whitman.
Mr. Whitman, you're to be escorted off the premises. You're suspended from duty, pending an inquiry into a charge of theft.
Theft? What theft?
You took a serving of coffee from the canteen without paying for it.
I don't recall any such incident.
I was there. It's all documented. You're permitted 5 minutes to clear your desk.
Don't let the bastards grind you down. It's up to you now, son. If you got the balls.
Lake.
Yeah.
I'm Susanna Marshall, specialty trainer.
Pleased to meet you, Susanna. I got a call.
Yeah, the nurses are querying cellulitis. So, how are you finding UH, Mr. Lake?
Fine, thank you. You can call me Rob.
Calling a consultant by his first name. Hope the sky doesn't come crashing down.
Morning.
Morning.
Start enoxaparin. I can order the ultrasound. It's on my way.
You really are new here, aren't you?
Why do you say that?
You'll see.
You've got me curious now.
Thanks, Mr. Lake.
Dr. Clacy? Sorry to bother you, I'm Rob Lake. I wonder if I could trouble you to do a ultrasound on a gynae patient with a suspected DVT.
I have to make sure this gets through your skull. Go and get a form, fill it in, and get your consultant to sign it.
I am the consultant.
Give it a real push. Go on, you can do it. You're doing really well. Okay, it's crowning. Here it comes. Come on, push. That's it. Come on, really.
Ingrid, I'm Mr. Lake. I'm the consultant.
Push. Come on. Really, really well. That's it, that's it. Oh, come on, you can do it. That's it. Bear right down, you're doing so well. Push. I can see the head, you're doing so well. Push, go on, my love, push.
Okay, Ingrid, let's take a look.
Really well.
Come on, I want a really big push now.
Okay. Nice big push.
That's it. Push. Not long enough.
Good. Baby's coming. Come on, Ingrid.
It's coming. Good girl. Good.
Come on, Ingrid. Big push.
Good girl.
Okay, babe. Baby's out. Let's go. Push.
Shoulder. Come on. That's it, girl. Come on.
Right, someone keep an eye on the clock, McRoberts. Ingrid, we're pushing your legs right back to open the pelvis up. Your baby's shoulders are jammed at the moment. This is going to help get the shoulders out, OK? OK. Big push, darling. Big push.
Push. Really. Come on. Good girl.
Susanna, give Super Baby pressure.
Keep pushing, keep pushing.
Come on, Ingrid, let's go.
Really good. Really push. Come on, push.
30 seconds.
Come on, really push.
Right, I'm going to try and turn him.
And 60 seconds.
All right.
OK.
Still got time.
I'm going to try and release the posterior.
Keep pushing. Keep pushing.
Come on, Ingrid, push.
Shoulders jammed. I can't get him out.
1 minute 30.
Do it.
Someone call. Ingrid, big push. Come on.
1 minute 40.
Come on, Ingrid.
Keep going. Come on.
Right, Ingrid, listen to me. Listen to me. This is very important. You're going to hear a crack now. I'm going to have to crack your baby's collarbone. It will heal, but I've got to do it to get your baby out. Do you understand?
All right, all right, all right.
Really well. Good girl. Push. Keep pushing. It's the boy. It's a boy. It's a lovely boy.
Well done, Ingrid. Good girl. Scissors. Go. Go close, please.
Where's the baby?
It's all right, they're just checking the baby out.
Is he
He's
okay?
Yeah, they're just checking. That's what the doctors are going to do.
We're just giving him some oxygen. Okay, Ingrid? Why can't I hear
Okay,
him?
gentle push there, please.
Sure, it's fine.
Gentle push. There we go. Okay.
Just the placenta. Well done.
Is he okay?
It's all right, Ingrid, don't worry. Don't worry.
What's wrong?
They're just checking him out. The doctors are just checking him out. He'll be all right.
Suture kit.
Few more minutes. Few more minutes. You did really well. They're just checking him out. He'll be all right. There you go. Wow.
Well done, Ingrid. Well
Congratulations, Ingrid. Well done.
Well done.
Well, well.
Hello, Tony.
Chrissy.
Should we talk here, or would you rather we went to the clubhouse?
No, here. A very tight schedule.
Of course. This is the reason you're far too busy to come to the hospital, or indeed return any of my calls. Your tight schedule. We want to make a deal. So Paul and I.
Who with? Devil?
Worse. With you, Mr. Whitman. We'll rescind your suspension and drop all charges against you.
Well, as you can see, I'm rather enjoying my suspension.
You've a dwindling private practice. Without your NHS employment, you're getting no more referrals.
Simply not true at all.
If you think life is good, then that's fine, Tony. But I think this could be like Kevin's epiphany. Keegan, on the golf course at La Manga, finally realising he was pissing away his knowledge of the game.
Kevin Keegan. Fucking Here's my golf partner. Excuse me. Lovely talking to you, Chrissy.
I wouldn't call it a pain, or even a discomfort. more a sense of unease, or as if something wasn't quite right, as it should be. The feeling seems focused on my lower tummy, but then radiates outward sometimes as well. What do you think, Mr. Whitman?
A situation has arisen with Roger Hurley, and Sir Paul and I feel it would be in everyone's best interest if he were to take up a position at another hospital.
At last, you've cottoned on to Hurley's incompetence. Well, I see why they gave you a gong.
The matter in question does not relate to Roger Hurley's clinical practice.
He received a caution for exposing himself.
Roger.
Roger Hurley will require a hagiographic reference from the senior consultant in the O&G department in order to move him on quickly and quietly. Now, clearly, this reference would be best served if the senior consultant in question is not currently on suspension.
I took a coffee refill from the hospital canteen and you charged me with theft. I was suspended for 3 years, my career put on hold, you bastards. You pair of total cocking wankers.
Good. Good. I'll let Chrissy here iron out the details.
Tony!
Polly, you been up to anything while I've been away?
Locum should be here by 8 a.m. If he's not, don't leave it to the administrators. Call the agency yourself.
OK.
I'll keep the mobile until midday, so if you need me for anything, I'm available.
Thanks, Rob.
Hey, Mary, how are you?
Good. Emptying the in-tray before your holiday?
Not really holiday, more a pre-paternal leave.
Oh, will you be back? For the regional O&G forum we're hosting, and I'm counting on a full departmental presence.
Yeah, I will be back, but I am going to miss the interviews for the new consultant post. That's not going to be a problem, is it?
No, we don't normally ask a recently appointed consultant to sit on the panel.
OK.
Well, enjoy the break.
Thank you.
I want to assure you, Mr. Hurley, we've listened to all sides in this matter.
Well, if you've listened to me, you'll know I'm the victim of a deep misunderstanding.
But you do see how this allegation does great damage to the hospital's image.
So I categorically deny the allegation. I'm sure Paul will support me.
He decided not to attend this meeting. I have a proposal for you. A position has become vacant at University Hospital.
OK.
University Hospital?
It's Mr. Roger Hurley. I might not be on your staff roll yet.
Welcome to UH, Mr. Hurley.
Thank you.
Just a small token, Roger, to welcome you aboard.
It's a very kind thought. Thank you, Mary.
We're very excited to have you join our team. We should set aside some time as soon as possible to discuss your research program.
Oh, I thought I'd give that a little while, just till I find my feet.
Well, that's for later. For now, I was going to prevail upon you to deliver a lecture. We're hosting the next regional O&G forum.
Oh, well, I wouldn't want to tread on the other consultants' toes.
Oh, God, no.
Yes, but you see how it might seem, just arrived and already hogging the limelight.
Roger, there's no point having one of the country's leading ovarian experts on staff without exploiting him shamelessly.
I'd be delighted to help, Mary.
Well, thank you, Roger. Have a good day.
You too.
Would you like to come through?
Sorry, boss. Have you seen his hormone assays?
Thank you, sister. Actually, I'll just check her bag.
Okay, let's go and see her.
It's fine. Good. Thank you, sister. Who's next, ma'am?
Tracy Clark. She came in on last night's take.
Tracy, hi, I'm Roger Hurley. I'm the consultant. Dr. Hammer's just telling me about your admission.
Initially seen by the surgeons with acute abdomen, they're happy to exclude anything surgically acute. Referred to gynae with LIF pain, which seems to have subsided overnight.
I'd like to examine you now, if that's okay, Tracy. Right, can you get an ultrasound scan for Tracy, please?
Yes, Mr. Hurley.
Thank you.
Shit.
Tracy, morning. Did you get a scan yesterday?
No.
Right, I'll come back to you. Thank you. Dr. Casey, sorry to trouble you. I'm Roger Hurley. Did my specialty trainee, Dr. Hammond, speak to you about an abdominal ultrasound for Tracy Clark?
We had a discussion.
Well, she said the patient said she hasn't had her scan.
You have to leave her notes at reception.
Sorry, Dr. Casey. Do you think you might be able to fit her in today? Hold on, Tracy. She's still not had a scan.
No, I'm sorry, I tried.
She's bloody late now. Let's open her up. All right, Tracy. Right to the back. That's it. All right, Tracy. Okay, stretch. Distorted cyst. The pedicle's twisted 2 or 3 times. We're going to untwist it. Oh, shit. Suction. Swab. Another swab, please. Curved cocker. Can't see a bloody thing. Suction. In here, in here.
BP's dropping.
Oh, suction, Farah. Come on, I've got to be able to see what the fuck I'm doing.
Sorry, Rob. We can't get in yet. Mr. Hurley's gynae emergency is still in theatre.
For fuck's sake, we're losing her. Come on, Farah. Suction now. Here. Suction now, Farah. Come on. Can't see a bloody thing. Farah, will you get the suction in there? Ah, shit. I can't do it now. Yeah, got it. Good. Another curved cocker, please. Well done, everyone.
Well done to you too, Mr. Hurley.
Have a tie, please. Some music, please. Scissors. Thank you.
Hi.
Hiya.
I was going to ask if you fancied a coffee. Already got one.
Do
you mind if I ask, is everything all right?
Yeah, fine. He said something about...
Rob, have you two been introduced?
The opportunity hasn't come up, actually.
Oh, well, I suppose this is it then.
Rob was my SPR when we still called them SPRs. I trained him.
Oh. Really? Oh, excuse me.
Sure.
You knew I was working here?
Well, it's not a situation I would have chosen. It's the way things turned out for me. But we could try and make the best of things. I'm not Ahab in the whale. Congratulations on your appointment, by the way.
Thanks. Congratulations on yours, Roger.
Thank you.
Thank you, Roger.
Of course.
For gynae, no mortalities. I had one patient transferred to HDU following perioperative blood loss. I'm happy to say that she's doing very well now.
Can you tell us more about the perioperative blood loss, please, Roger?
Yes, the patient was admitted with left iliac fossa pain. Before we could make a firm diagnosis, the ovary hemorrhaged, but oophorectomy was successful.
Any further questions for Mr. Hurley?
Thank you.
Rob.
Obstetrics, we had no maternal or fetal mortality. We experienced a shoulder dystocia, which resulted in a clavicular fracture. However, I'm pleased to say that mother and baby are now doing extremely well. We performed 12 caesarean sections, giving a rate of 24%.
As you know, Rob, that's in excess of the target set us by the Department of Health. Would anyone like to comment?
Moving on to gynecology.
You'll feel weak for about 24 hours, and then we'll assess your progress, but hopefully home in the next few days.
Thank you.
Donna? Donna? What a surprise. How are you?
I'm fine, thank you.
What brings you here?
Oh, agency work.
I thought you'd left all this behind you.
How many of us have tried and failed?
Quite. Listen, I can't stop, but really, really nice to see you.
Sure.
See you.
Listen, we haven't really established operating protocols. I had a boss once that could be a danger to patients.
Shit.
You ever see me doing anything like that, you step in and stop it happening.
Rob, you're totally on the ball.
I know, I'm just saying you save the patient from coming to harm. Okay?
Gynae. Speaking. Hi. No, it's just your call took me by surprise, that's all. Let me think about it, and I'll see how it fits in with my plans. Yeah. Okay, bye. Spicy.
Well, I'm sorry if my invitation took you by surprise. I've moved to another hospital. Haven't really made any bonds yet. So have you seen anyone from the old days?
I've lost touch.
Yeah. I suppose I'm the same.
That's not quite true, is it, Roger? Rob Lake?
Oh, yes. We're trying to make the best of it, though.
Does he want to make the best of it, though? As I recall, you got him suspended, and then you refused to provide him with a job reference.
I look back on that adversarial relationship with some measure of regret. I was a fairly new consultant, only a couple of years into my post. I was ill-experienced. There were things that I didn't deal with as well as I could have, and Rob was one of those.
You never struck me as someone who suffered from self-doubt. Why did you move jobs, Roger?
Well, I was ready for a change and the post at UH came up.
But you were in your element. Clinical director.
Harriet and I are no longer together. It felt like a fresh start.
I'm sorry.
It's such a surprise seeing you on the ward. A very pleasant surprise. One of the things I realized about my last post was that I didn't confide enough in my colleagues. As a new consultant, I should have been open to advice more often and should have tried to share the pressures more.
What pressures do you mean?
Well, I felt vulnerable to criticism. What doctor or nurse doesn't? Single accusation and at the end of your career. Occasionally, procedures didn't go as well as they might have, and you continue as if these things have no effect, but they do.
Hi, Rob.
Is this her?
Who?
The right patient?
Dawn Blair, vaginal hysterectomy?
There we go.
We're expecting a good turnout, Roger.
Oh, very good.
I received this. It came via the internal mail, addressed to me as clinical director. I decided to look over the notes relating to your patient who had the severe perioperative hemorrhage.
Mm-hmm.
She was admitted as an acute abdomen, but you didn't make the diagnosis till nearly 36 hours later, by which time her condition was life-threatening.
Well, there were problems securing an ultrasound scan.
I see.
So you're aware of Dr. Clacy's personal style?
It's a matter for the radiology department. We just have to make the best of it. I'm sorry, Roger. Consider the matter closed.
Thank you, Mary.
So, I've decided the only thing to do is to open her up.
Are you sure it's this way? Bloody UH, her signs don't make any sense.
Anyway, the thing is shaped like a football. So I've said, why not turn it inside out and she can use it as a swimming pool?
Tony?
Rob? Rumours of my death and all that?
You don't have to go everywhere handcuffed to a security guard, then?
No, it's the post-suspension equivalent of care in the community.
Who's the unlucky hospital?
Right,
You're fucking kidding. He's back at your place, you're working with him, and you never said anything.
Because you'd react like this.
I'm reacting like this because you never said anything.
That'll be the reason.
Welcome, everyone. It's particularly pleasing to see those colleagues who've made the journey from our neighbouring hospitals. Delivery room 1, please. Thank you.
Victoria, I'm Tanya, your midwife. Let's go through to the delivery room.
Okay, you're all right.
How many
is that? Two?
That's it. Take it easy.
Take it.
It's okay. That's
Another one.
Okay. Slowly does it. Slowly does it.
Okay.
That's it. That's it. It's all right.
So I'm Roger Hammond, consultant. All right, sorry. Tense, tender uterus.
Put this over your face, okay? Some oxygen for you and the baby. You're in the right place, okay? We'll look after you. There we go. Keep your arms straight. You're doing really well. BP's 90/60.
Okay, there's the baby's heartbeat.
Can you hear it? Doing really well.
Okay, ultrasound now, please. Thank you, Farah. Often an abruption is difficult to visualize, so diagnosis has to be purely on clinical grounds. Victoria, it's most likely that placenta has detached from the lining of the womb, causing the severe blood loss. At this point, the baby's not in distress, and we're replacing your blood loss. Hopefully the placenta will stabilize and the bleeding will stop. Okay?
BP's still 90/60.
Let's give her 2 units of O neg while we wait for the cross-match, please. Doing very well. All right, Victoria. In fact, can you make sure there's an anaesthetist standing by, please? Deceleration. Victoria, I was hoping that the bleeding would stop, but it hasn't. I'm afraid I'm now concerned for the well-being of your baby if we delay any longer. I would like your consent for a caesarean section, please. Yeah, good. I think it's the safest course. Transfer to theatre, please. Forceps and scissors, please. We're doing a vertical incision because the uterus is small for dates. Oh, shit, suction. Swabs. I can't get in. Oh, shit. Sending the incision.
BP 90/40.
Pressure's dropping.
I can hear, for fuck's sake. Bones out. Under pressure. Up. Of Synto, please.
More cross-match and FFP.
Delivering placenta.
Going to.
Cord gases on that, please. Carbopros 250 micrograms for intramyometrial injection. Come on. Yeah. Okay, let's try and save the uterus. Give me a big stitch, please. Come on, I can't see a bloody thing. Suction. Come on.
She's in VF arrest. Go to deep up to 200. Clear. Clear. Shocking. She's asystolic. Start chest compressions. Adrenaline.
press the uterus then.
Good mobility?
Yeah.
Okay. Continue current management. Excellent. Who's next?
Miss Hall.
Ready?
Yes.
Simon, I'm afraid I've got some bad news. You did everything you could. Unfortunately, it's for the baby. But the bleeding is very severe. We won't able to stop it.
My baby.
The baby was premature and very weak. The bleeding was too severe for the baby to survive. I'm really sorry, Simon. I understand how difficult time this is for you, and if there's anything we can do, please don't hesitate to ask. I'm really very sorry. I did everything I could for them, but the degree of fetal anoxia and the volume of blood loss was... the bleeding was torrential. Perhaps I could have got the baby out a bit sooner or made an earlier decision to carry out the hysterectomy.
Would that have made any difference, do you think?
I don't know. It's impossible to say.
But it might have saved her life.
Yes, it might have. I mean, all these decisions lie in a grey area of clinical judgment, and I thought that once I'd been a consultant for long enough that the grey areas would become black or white, but they haven't. I'm not sure if they do for anyone.
Is it something like this that made you move, Roger?
No, that was a separate matter. A silly misunderstanding. The police got involved. They didn't press any charges, but it was yet another thing to come between Harriet and me and...
It's okay, Roger. It's okay.
Do you still see your husband?
Ex. You're single now.
Oh, separated.
That's single. So what happened with you and the police?
Well, I was drunk. Things were bad between Harriet and me, and, well, they hadn't been good for a while. Things weren't great at work either. I don't remember much about it, but... well, I couldn't find a toilet, and I used an alleyway or something. I was convinced no one could see me.
You were having a piss?
Yeah, of course. Why? What did you think I meant?
No.
First Tony, now Hurley.
What are you talking about?
Did you know he had a police caution and not tell me?
We agreed you and Roger Hurley would keep away from each other. I didn't want to inflame the situation.
Someone had to write a reference for him. Who could that have been?
It was Tony.
Exactly. Tony fucking Whitman. He's written that reference to get his job back. You're working with him again. Is he working today? Is he?
Rob? Rob!
Cabin isn't pressurised. I've got to keep her below 10,000 feet. Rob. What are you doing here?
Excuse us.
Thank you.
Polly's having a scan.
Ah, the young Lake in the making. Let's hope he's not all surly and northern.
You've sold out, haven't you, Tony? Giving Ellie a reference so you can grease your way back in. And to cap it all, his first post is at my place.
Yes, that was hilarious, I admit. Unintentional.
Yeah, it's fucking hilarious. Your reference counted because you're a senior consultant. I want you to rescind it. And I want you to testify to all of Hurley's fuck-ups that he's committed over the years. As a senior consultant, you'll be believed.
Why go looking for trouble, Rob? We've been through all that Hurley shit, and we're lucky to survive it. I'm boss of my department again, you're a consultant on your own patch. It's time to look to the future, son.
Doing this?
Someone has to.
No one has to.
I do.
Why? Tell me. All that we've worked for, what we've got now, that's what's at stake.
I know.
Why now? Now that we've got a future. Do you think that we have a future?
I've done nothing for too long. Start, finish early.
Drive me home.
Pulse and respiration were absent in the baby, a boy weighing 1.94 kilograms. He did not respond to resuscitation and was pronounced dead at 16:11. The mother was severely hemodynamically compromised by the abruption. Urgent efforts were made to close the uterus, but the patient experienced a VF arrest. She received 6 cycles of CPR, but did not recover from asystole. She was pronounced dead at 18:30. I've arranged counselling for the patient's husband, and the same opportunity has been afforded to all these staff involved.
What uterine incision did you employ?
Well, given the stage of the pregnancy, I adopted a vertical incision of the uterus.
It's unorthodox to use a vertical incision after 28 weeks. Why would you do that?
The uterus appeared small for the dates, and I judged it to be the appropriate technique.
How long did it take you to deliver the baby from the time after you opened the uterus?
I'd have to consult my notes, I don't know.
Oh, that's okay. I've got them here. Working backwards from the time of the baby's death, about 5 minutes. I'd argue that this delay contributed to the baby's death, and that an orthodox transverse incision would have resulted in a prompt delivery.
Mr. Lake, we appreciate the M&M meeting as a forum for robust debate, but
Did you avoid an orthodox transverse incision because you were concerned about extension into the venous plexus of the broad ligament?
Well, we're all aware that that is the rationale behind the vertical approach.
Did you consider hysterectomy in the mother?
Yes, of course.
At once?
Well, obviously, it was an option.
At once?
Mr. Lake, I really
You
think...
delayed a hysterectomy in the mummy because you wanted to give the patient, prima gravida, the chance of having another baby. And in delaying the hysterectomy, you allowed her to exsanguinate.
Mr. Lake, I'm going to have to ask you
No,
to
we
leave
asked
this.
him about Karen Taylor and her baby.
Mr. Lake, if you
Let's
have a
talk
problem...
about Karen Taylor, Mary. This is a case that you're unaware of. Roger Hurley managed a placental abruption 4 years ago, on which the mother, Karen Taylor, who was left brain damaged, and her 28-week gestation baby was stillborn. Karen Taylor's brain damage occurred as a result of Mr. Hurley extending the uterine incision into the broad ligament, which is why he was desperate not to make the same mistake this time. But in doing so, he caused an adverse delay in delivering the baby. As in the case with Karen Taylor, he also delayed performing a hysterectomy, which is a mistake you haven't learned from, Roger, and is the cardinal error responsible for Victoria Newby's death. Submucosal fibroids.
Mr. Lake.
Miss Darcy.
Come with me at once, Mr. Lake. I would like an explanation for your outrageous conduct.
I want to protect the patients from Hurley.
We look into every maternal death. We've looked into this one, and there's no evidence that Roger Hurley was negligent.
He fucked up the cesarean and he fucked up the hysterectomy.
You're wrong about him, Rob.
I was his SPR.
No, you're wrong about him. He's a decent, hard-working consultant.
Then why's his reference fake? Would you have given him a job here knowing that he had a police caution for a sexual offence?
Clearly, I need to look into this allegation.
Yeah, I'd say so. You'll stop him seeing patients in the meantime.
You do your job, and I'll do mine.
Who have you been talking to?
No one.
Well, you must have talked to someone, Tony, because UH are querying Roger Hurley's reference.
I resent the assumption that I'm the one with loose lips here.
I can assure you, Sir Paul...
Oh, just stop it. This isn't The Apprentice. You do understand what this means?
Oh, yes, that we've been caught.
We.
Oh, here we go again.
Can I help you, Rob?
You seem pretty friendly with Roger, given that he's under investigation.
Well, I've looked into this matter, and I find your accusations against Roger baseless for two reasons. Firstly, that although his profession is exempt under the Rehabilitation of Offenders Act, Roger was under no obligation to declare a caution. It was his hospital who sought to conceal it from his new employers.
If it should have been in his reference, he should have declared it, you.
More importantly, that the nature of the misdemeanour, as described to me, has no bearing on Roger's fitness to practice as a consultant obstetrician and gynaecologist. Our management here is butting heads with their management over there, so let's leave them to it. I don't take kindly to one doctor in my department seeking to denounce another. Doctors stick together.
You may have sweet-talked Mary, Roger, but you and I know the truth.
So I thought we had an understanding. Why won't you let this drop, Rob?
You destroy people's lives.
If you attack me, then I have to defend myself.
You destroy people's lives, then you just walk away.
No, I do neither. I've just spoken at length with Victoria Newby's husband.
Widower.
I've just spoken to him at length, and he, like everyone else involved, agrees that this was a tragic accident.
Then I'll make the complaint.
You weren't there. Your testimony would be speculation, nothing more. Who's going to take a complaint like that seriously?
Shit. Contractions are 4 minutes apart. But she's breech. She was due for an elective. She needs an emergency section. Fuck it.
What's happening, Rob?
They're full.
Oh, shit. Ow.
It's okay, I'll sort it. It's Mr. Lake who's covering obstetrics today.
What's happening? Oh.
We're gonna have to go to my place.
scrubs on.
The consultant's waiting for you, Mrs. Lake.
Hello, it's Polly, isn't it? Okay, I'm Sarah. I'm your anaesthetist. That's it. Let's pop you out. No, we need to pop you up on the table as soon as possible.
I'm just going to go get you a room.
No, I'm having a contraction.
All right.
Hello, Polly. Everything's perfectly routine. We'll get you a spinal, and by then Rob should be back here with you. But, we should crack on, yeah? Okay, Polly. As soon as the anaesthetist is happy, we'll get started. Bit of pushing and pulling now, Polly. Of course, you know all this.
You're doing really well, Mrs. Lake.
I'm not Mrs.
Doyens, please. The dads don't usually get this close, Rob.
I'm not the usual dad, though, am I, Roger?
Scissors and forceps, please. Clean knife.
Stop the procedure. Mr. Hurley, I'm relieving you. Everybody wait while I scrub.
What are you doing, Rob? Rob? What's wrong?
Nothing's wrong, Polly. Rob, are you mad? I'm about to deliver the baby.
You're endangering the patient and the baby's lives. I'm taking over.
Rob, what's gone wrong?
Nothing's gone wrong, Polly. Everything's absolutely routine and under control. Does anyone disagree? Right, I'm going to do the correct thing and continue with the delivery.
I'm the baby's father and you respect my wishes. Somebody get me a gown. I'm withdrawing consent for you to continue, Roger.
Rob!
Rob, this is insane.
You're making a mess of this operation, Roger. I'm taking
Rob,
over.
has he damaged my bladder or something? What's going on?
No, Polly, the bladder's successfully been reflected. Everything's fine.
I'm intervening before he does do some damage, Polly.
Rob, you're totally out of order. You can't deliver your own baby.
There's no such rule. However, there is one against negligent practice.
Well, I'm not negligent. I'm not being negligent.
Great, Rob, tell me what's happening.
Everything's perfectly fine. Rob, this is ridiculous.
Everything's going to be fine, Polly. Step aside, Roger. Rob. Step aside, Roger.
Please don't do this.
Roger.
Please stop this.
Roger.
Please don't do this. Please don't. No. No.
Clean knife.
Please stop this. Please.
Doors out. Under pressure. Clamp. Scissors.
Where is she?
Congratulations. With the first one, there's possibly feelings of denial that you're not ready to be a father. It's an emotionally difficult time. We don't always know how we're going to respond. I suppose I'm saying, Rob, I don't want this to turn into something.
My girlfriend could have bled. My baby could have died.
But that's clearly not the case.
I'll say that you were just about to put your scalpel into her bladder.
You'll say, you mean you'll lie?
Truth, lies. A little bit late for such unhelpful distinctions, don't you think?
But the theatre staff, they'll back me up.
I'm a consultant obstetrician. Whose word counts for more?
This is insane, Rob. Why are you doing this to me?
She'll see you now.
Rob, I don't deserve this.
Either you were risking my life and our baby's life, or you were using us both to further your personal vendetta against Roger Hurley.
Roger Hurley destroys people's lives, Polly. He kills people.
Was I in danger? Was our baby in danger?
He kills people.
You bastard, Rob. You never really wanted this baby. You never really wanted me. If you were prepared to risk it all for... You'll never see this baby grow up. Never. Never.
Hello, Mary. Morning. Can I help? Sorry, Sharon, can you give us 10 minutes, please? Thank
you. I'm very sorry, Roger. I've received formal notification from Rob Lake that he's reporting you for alleged negligence during the delivery of his baby daughter. He's also reporting Tony Whitman for providing a false reference. Let me tell you, I did everything I could to deter him, but he's blown the whistle.
No, it's denunciation. A word to the authorities, and then suddenly a poor innocent like me is shipped off to the gulag. Look, there are a dozen consultants and administrators. Surely together we can shut him up.
He's reported you to the General Medical Council.
No, I don't deserve this, Mary. I don't deserve any of it.
I'm sorry, Roger. I've had no choice but to advise management to suspend you from clinical practice. They allow 15 minutes for you to clear your desk. Take as long as you want.
Right. I think we'll probably have to keep our eye on this, but you know.
So?
So?
I'm feeling okay. Better than I thought I would.
Good.
I'm really sorry, Tony.
No. GMC You know what they'll do? They'll skirt around the real issues and they'll probably ban me from writing references or something. Relax, boy, I'm fine, absolutely fine. Do you know, I've had some experience looking after babies. 20 years ago. They still use nappies, or have they invented something better? I'm serious, Polly, you know, if you need anything at all.
Oh, thank you, Tony. You're a good friend.
Well, I was hoping that I'd be rather more. Guess you're a pushover now, hmm? Hard up, single mum. Seriously, Polly, I mean it. Is there any chance that I could be more than a friend?
No.
Just a tiny chance?
No, Tony. Maybe.
I need a minute. Thank you. You blew the whistle. You always said you'd never do that.
I did.
It's as likely to ruin your career as mine.
Maybe both.
You made mistakes too.
I did.
Medical mistakes that hurt people, that cost lives.
I did. And I tried to make things right when I could. You didn't.
The system doesn't allow for that level of understanding, only blame.
You could have asked for help.
Really? Did you ever?
For years, a dangerous doctor's been protected, quietly moved on. Glowing reference has been falsified. I really don't believe that the GMC won't want to know who knew what and who covered what whilst babies and mothers were being harmed.
It could take years.